My name is Meggan Orr, and I have chosen the Native American culture for my Transcultural nursing presentation. It is very important that healthcare workers have an understanding of the different cultures and their beliefs. Native Americans have a unique set of beliefs in regards to their physical and spiritual health. Their medical beliefs and practices are unique. They use herbal remedies and healthcare rituals, and they also have higher risk factors due to certain circumstances in their health. So in this presentation, I will talk to you a little bit about Native Americans and their medical beliefs and practices and use of rituals or their traditions. Native Americans believe that their mind, body, and spirit must be in balance in order to prevent illness. So if one of these aspects, as you can see in this medicine wheel on the left, physical, intellectual, emotional, and spiritual, if one of these are off balance, then that can cause illness. Native Americans believing that unbalance between the mind, body, and spirit can cause illness, along with violations of some of the restricted rituals such as witchcraft, taboo, intrusion by spirits, and loss of the soul. These religious practices are very important in maintaining health and warding off illness to the Native American culture. Native Americans might utilize medicine men, diviners, specialists, and singers for treatment of their illnesses. These special people use powers against enemies. They might use herbal treatments or rituals or sing songs to rid a person of their illness. Also, they motivate an individual to recover. They will provide guidance, motivation, encouragement, and pretty much steer them in the right direction to prevent illness or treat illness. Tribal healers focus on prevention, treatment, and health maintenance. Medicine men can serve many different purposes. They will pretty much direct the patient's health care and provide some kind of treatment for their illness, whether it be some kind of ritual or some kind of herbal medication or singing. Diviners will diagnose, and they may use herbs and other interventions to treat illness. And singers can cure by the power of song or by simply laying their hands on the person because they believe they have the power of healing. Native Americans value family, even extended family. So you may have patients that their great-great-grandfather's in the hospital. That is still of high value to them. They want to stay very close-knit in their families. So you want to make sure that you involve them in their family's care. Elders are also very important to the families. The elders will assume leadership, and they provide guidance for the rest of the family. Now we're going to talk about childbearing for Native Americans. Hospitalization is usually for illness only in Native Americans, so prenatal care is usually not sought. During pregnancies, women may restrict their activities, they may change their diet, they may perform certain rituals such as washing their hands and their feet every day. Midwifery is also an important part of the Native American culture. So instead of going to doctors, they may go to midwives in order to kind of keep a checkup on the pregnancy and how it's going. During childbirth, I've kind of listed a few things that may be traditional for Native Americans, such as using herbs and teas during labor. We've already talked about midwives. They may also have many family members present, which ties back into family being very important. They may also save a length of the umbilical cord to add to a sacred bundle. This bundle started when they're born, and they kind of add things to it throughout their life. They may also save the placenta because they believe that is a part of the body, so they would rather it be with them when they're buried, so they may bury it or they may eat it. They may also sing special songs. They may also burn incense and do what's called smudging the newborn. Children 0 to 17 years. In the Native American culture, they view the beginning of a child's life as the beginning of the life cycle. The cycle being birth, naming, childhood, adolescence, marriage, child rearing, old age, and death. An elder of the child's tribe will more than likely be over the child's health care, so you should let them be involved in whichever way that they wish to be. Healthcare workers must also create a trusting relationship. Native Americans are very modest, so you have to make sure that you earn that trust between them so they can be more open with you about their health. Children are also at a high risk for developing otitis media and hearing impairments. In adulthood, most have already developed their perception of their health beliefs. So, as healthcare workers, we must be very careful not to offend these Native Americans because of their different healthcare beliefs. We want to make sure that we greet them with a gentle handshake. We want to avoid direct eye contact. We want to avoid hugging and touching because, again, they are very modest. We want to make sure that from the beginning that we understand their healthcare beliefs and their wishes and their needs, and make sure there are no communication barriers. Just as I've already said, modesty is very important. We also want to try to provide the same-sex healthcare providers. So for males, we want to provide a male nurse. Females, we want to provide a female nurse. We also want to show respect for all family members. And also we want to show respect for their sacred items. And we want to make sure that we get permission before any test is done, especially photographic tests such as x-rays or CT scans, because this could be very offensive to them. Now, to talk about the elderly, we've already said that they're very well honored and highly respected. So the care of the elders is very important and sacred. Most Native Americans believe that elders should be cared for in the home, and that the elders should be around the children of the family, because the elders can teach the children things about life and how short life can be, to try to motivate them to live a good life and keep their body, mind, and spirit in balance. So it's very important that family members would be trained to take care of the elderly in the home. Now to talk a little bit about end of life. Native Americans believe that death is natural, and a patient may report seeing a dead loved one at the end of their life. They may request traditional foods because they use food to honor the dying and deceased. So they may be seeing someone, so they may ask you for a food that reminds you of them, or that a food that they decided was going to be in that person's honor. The body of the deceased should not be moved until a family requests. The family may purchase special clothes to put on the body before it leaves the hospital, so it's very important to find out the family's wishes. Native American communities rely on the medicine men and traditional healers, and they also rely on the elders in their community. Native American tribes view themselves as family, and we've already said that family is very important to them. So the tribes may meet together to have sacred rituals for healing. Just as I told you I was going to talk a little bit about the risk factors I think it's important for healthcare workers to know about the risk factors of Native Americans, so I'm going to run through them real quick. They have extra vertebrae, so they're at increased risk for lower back pain. Also cardiac disease if they're older than 35, diabetes, strep throat, gastroenteritis, trachoma, genetic disorders, and also the alcoholic metabolism rate may be more rapid. Native Americans are very unique individuals with their own set of beliefs in regard to their culture. All individuals deserve equal care, and in order to provide equal care, we must have a knowledge of different cultures. So it's very important that we research and we provide ourselves education on the different cultures so that we can provide excellent care to these people, no matter what culture they are. So we have to remember in the Native American culture that they use rituals and herbal remedies, and they're very modest people, so we want to make sure we don't make eye contact and we don't touch them without permission. And we also want to make sure that we keep the family involved in their care and show high respect towards elders in the communities. I've also provided a few links of information for healthcare workers to go, and it will actually tell you ways to take care of Native Americans and their healthcare beliefs, and things like not making eye contact and not touching them without permission. Just gives you a base of knowledge on how to provide care for Native Americans. And that will conclude my presentation on the Native American culture. I hope that you learned enough information to give you a basis of knowledge about the Native American culture so that you can provide culturally competent care. Thank you and have a good day.